Friday. Happy Friday, guys. Um, I'm out here in South Carolina and was a speaker at a conference, and I thought I'd just get on here to share some of what I talked about. And it was super impactful. Not my words, but the people who were in attendance of our session. And I'm super excited to kind of share some of those notes and dive in on the topic of mentorship and the lifetime value of it. Mentorship is often a word that is overlooked or often a role or a task that is utilized. And I think mentorship matters, and I have a lot of success stories personally and of those who I've helped, and that other people speak about in their experience with having a mentor that I think is important to talk about. And so, if you don't have a mentor, I really want you to think about why you don't. Perhaps you don't know what a mentor is, and why you should have one, where to find one, when to get one. And so, I want to quickly talk about some of those things right here now with you. But before I do, I want to let you know who I am. I'm a certified health education specialist. I'm also the CEO at Jenkins Public Health Consulting, where I mainly help health-focused organizations like hospitals, medical centers, health departments, pharmacies, and other for-profit companies who have a health-focused program or initiative. I help them further develop the program. I help them strengthen their existing programs. I help them identify strategic partners to ensure sustainability of their programs and capacity. And I also help them build trust with community through effective community outreach and engagement strategies that benefit the organization and the community so that there's a mutual connection and collaboration among what's resources that are being provided and how people are accessing them. So a ton of health equity, a ton of health literacy, really addressing health disparities to improve health outcomes, and also serving like under-resourced, underserved areas, marginalized communities, but all communities who need resources for whatever reason. Because, chronic disease doesn't have a status to it. Chronic disease can affect and is affecting everyone. And that's really what I specialize in, chronic disease and injury prevention. And so, diabetes rates is about more than 60% of people in the United States have at least one chronic disease, knowingly or unknowingly. And I believe the rate is even more of how many people actually have a chronic disease and are on more than one medication, right? And so it's super important. But I want to talk about the power of mentorship and how the lifetime value of mentorship is incomparable to any other thing that you'll ever invest your time in, and invest your money in. I talked about an amazing example of the value of mentorship, and I highlighted the fact that a young lady, she was on track to want to work in healthcare, but her college experience actually did not work out. She went to college wanting to work in healthcare, and things just did not work out for her. She was someone where college didn't work for her, right? And we know trade school's an option. Some people go to college, some people don't go to college. There's still people who are very successful in that. And I talked to her, and I said one thing to her, and it changed her mindset, and it also changed the trajectory of her career. And it was actually my sister, even though I have tons and tons, dozens and dozens of examples, but this was an example I gave today. My sister, which we did some research yesterday or 2 days ago, and we identified that she was actually able to accelerate her career by 12 years, accelerate her career 12 years faster than the average person based on mentorship, literally. So my sister actually was still able to become a paramedic, and she actually is in an industry where predominantly people become a paramedic by the age of 36. She was actually able to become a paramedic by the age of 24. So through mentorship and a strategic approach and allowing her vision to be the forefront of all discussions, she was able to catapult her career in ways that people don't achieve. It's rare, right? So people become a paramedic at the age of 36 on average. She did it at 24. Also, 70% of people who are paramedics are male. 76%, and let me make sure I'm saying those statistics. 76% are male and 70% are white. So she's a black female who achieved a significant jump in her career 12 years sooner in a position that is predominantly male and white, dominated. And so that also highlights the value and the benefits of mentorship, right? There are people who are unemployed who connected with a mentor And after being unemployed, and I'm talking to me as their mentor, they were unemployed for 2 years after having all the degrees, after having all these certifications. They were unemployed for 2 years, and within 90 days or less, they were able to land a job as an epidemiologist, right? Mentorship is not just about landing you a job. The right quality experience mentorship is not just about landing you a job. If that's the only focus, job searching, job searching, job searching, that is not proper mentorship. Sorry to break it to you. Mentorship, that's the ultimate goal, right? For some people, they have different goals for why they're finding a mentor. And it's so many different goals that, in your life that can align with finding a mentor. But if the goal is a job, we need to address all this other stuff, right? It could be confidence building, right? Because once you land that interview, there's a whole other skill set that needs to come to the table for you to wow the hiring team. But even before then, I talk about a results driven resume, a results driven curriculum vitae, also known as CD just for short, but curriculum vitae. I believe that 97% of people who are not landing their interviews is due to a poor resume because it's not written in a format that's results driven. If you don't know what a results driven resume is, go ahead and look it up on Google. But it's having measurable results that actually highlight your achievements in your role. It's not just a copy and paste of your job description. 97% of people across all industries are not landing jobs or not landing interviews because of not having a results driven resume. And I'll even argue to say resumes, traditionally one pagers, are outdated status quo behavior, right? And if you only have the amount of experience that fits on one page, fine. But 99% of the time, you have more than 3 pages of experience if you're an adult person. Now, if you're a high schooler, you're still in college, you might have a little one page, but you should be actively involved in associations, volunteering, have a job. Those will go on to 3 pages or more potentially, right? But for those who are in college or have graduated college and you're looking to get land a new job or get a raise in a new role or become a speaker, you have to be writing your resume completely different than 97% of people and what they're doing, which is status quo behavior. That's leading them to not land these positions, okay? You don't have to have all the degrees. You don't have to have all these certifications. You don't have to have all the experience. But knowing what to say it and how to write it on paper and then verbally know what to say and how to say it during your interviews is what changes the game. There was a lady named Francisca. She was she was accomplished in a way, but she also wanted more for her career. She wanted more for her life. But she was lacking confidence, completely lacking confidence because everything everyone else told her she couldn't do this, she couldn't do that because she didn't have all the degrees, she didn't have all the experience. But guess what? When you're connected with a mentor who actually feeds into your vision and doesn't tell you what's not possible, but figure out a way to make it possible, that is what changed the game for her. So we improved her confidence. We improved her interviewing skills. We improved her communication skills. Guys, she was able to land a senior level job at a national institutes of health. And I think it's a national networks of public health or something like that, all the acronyms. Get, blew my mind, blew her mind, but that's the power of actually pouring into someone else's vision and not telling them what's not possible because you don't think that's possible. That's also the power of networking. That's the power of building out an ecosystem of networks and intentional connections right now where you are in your life so that when it comes to a time where you're looking for a new opportunity, a raise, a new job, to speak, to volunteer, whatever that goal is for you to write a book, that's when you can look into your pocket of intentional connections that you have made to see who can help you. Guys, I talked about this today at the conference. And most people had a mentor, but they were a mentor who was their teacher. The mentor was an academic professor. The mentor was their coach. Those are all great, but there's also important to know that sometimes, depending on the type of mentor, you can't always be transparent. You can't always be completely transparent with them based on the type of mentor that they are. And that's not to say they're a bad mentor, but you need a mentor where you can be completely transparent with them so that you can get closer to that goal a lot faster by overcoming those barriers that you typically and usually can't talk about in those types of settings, right? You can't tell your teacher that something that could affect your grade. but you can tell your mentor everything, who's a third party person who really doesn't have the power to make any type of decisions that can impact the outcomes. You can't tell your boss certain things that could affect your job, right? But you can tell your mentor, again, who's a third party person who can help you overcome those barriers so that you can have a sustainable job and also probably higher pay and know how to negotiate, right? You can't ask your boss, hey, I want to negotiate this offer letter that you're sending me. How do I do that? They might tell you, but that's rare. That is rare, guys. And technically, like, they trying to keep their budget the budget. So if you're trying to negotiate something higher than what they're even offering you, it just doesn't work. Okay. So a third party person as a mentor is always best, even though you can have them as your mentor as well. So the power of mentorship, the value of mentorship is amazing. It's a lifetime value to that. It's more valuable than a car because as soon as you drive a car off a lot, it loses its value. But a mentor, they can help catapult your career, your success 12 years sooner, right? A person who has a mentor is 5 times more likely to be promoted than those without a mentor. A person with a mentor is 5 times more likely to be promoted than those without a mentor. That is just research. I've seen it happen for people all over the world, literally, that I've mentored. And it's not about me, it's about them stepping into their purpose and taking accountability for where they are right now to get to the next level in their life and career. It is possible. Your degrees, your certifications, those certificates, none of that matters. But accountability at the heart of it really truly matters. Thank you for those who are tuning in and listening in. I appreciate your engagement. Thank you so much. But let me see here. What really highlighted mentorship and the value of mentorship for me was when I moved from Indiana to Tennessee. And when I moved from Indiana to Tennessee, it was the first time I ever lived in a different state than my home state. I'm originally from Indiana. And in that time of my life, I was like, what am I going to do? Well, like, am I going to be jobless? Because my fiance at the time, we were celebrating 7 years this year. My fiance at the time, he was getting a new job in a different state. And so we had to make that move. And I took a leap of faith to move to a different state. But I also knew that I didn't want to just settle for any type of job. I knew that I needed a job, but I was like, should I just settle for a job that pays at least what I was making? And then I was like, hold on, no, I'm great. Like it's a confidence thing, right? It's also a preparation thing, right? And it's also building out that connection, those connections, your network. So let them know like what you need and who can help me get there, right? And that's when the power of mentorship was truly uncovered for me. And in doing so and reaching out to connections who could help me, who could mentor me, I was able to land a director level job within 60 days, land a 50% raise in salary with only one interview. A director level job within 60 days, one interview, and it changed my life for the better. Because I could have settled, I could have just applied to any job. But the thing about it is, you can be applying to jobs however you want to apply to. But at the end of the day, you have to apply to jobs. It's not like it's harder to apply to director level jobs or high level jobs or better paying jobs than it is to apply for like low pay entry level jobs. It's all the same process, okay? And so just thinking of a strategic approach that is going to lead to a better outcome for your life and career, okay? No, I haven't been crying, guys. I don't know why. Maybe it's the blush. I don't know. The sun is right here as well. Maybe it's the glow. Yeah, I haven't been crying. It's just my natural beauty. Yeah, so I'm just super excited about this. The conference went really great in South Carolina. But I just want you to think about mentorship differently than maybe you have thought about. And also consider finding a mentor. If you are someone who is pursuing a career in healthcare or public health, let's connect. I want to know more about you, why you're working in healthcare or public health, what type of jobs you're pursuing, and maybe I have some resources for you, okay? Seriously. I used to work in healthcare. I used to work at hospitals and rehabilitation centers for people who were struggling with different type of injuries based on like chronic disease and also like dementia and Alzheimer's. And then I had this big awakening in my life. It was like, I don't want to work in a hospital where people are dealing with things that could be prevented, right? And so I changed my career from healthcare to public health, and I haven't looked back. Now I'm working with health organizations as an independent consultant, supporting their organization to implement programs that improve health outcomes of communities, right? And so that's what I've been doing. But in doing that, I've been able to take those skills and insights to people who are trying to pursue a career in public health and who are trying to work at those companies that actually hire me to help them so that they can gain the skills and the techniques and the strategy needed to land a job within these companies in 90 days or less. So they're literally the people that I'm helping through our public health mentor program are actually building skills within 90 days or less to go ahead and land, raises in their current role. I mean, four-figure raises, y'all. Like they're doing better than I was doing when I worked in corporate, even though I was a director before the age of 30. Like these, and they didn't have all these intricate degrees and certifications. It's based on any type of experience level. Seriously, guys. So no matter where you are in your life or your career and you want more for yourself, you need to think about it. What is your goal for this year? Why haven't you achieved it? And who's the first person who comes to mind to help you achieve that goal, right? And if you haven't achieved that goal and you're not sure about what your goal is or how to quantify that, then let's connect. Let me hear what your goal is, and perhaps I can provide you with someone who I know who can help you achieve that, because I don't know everything, I don't know everyone. But I do have a lot of connections who can help you get to where you're trying to be if I'm not that person who can connect you, to that outcome or resource that you're looking for. Another thing that I wanted to mention is also like oh shoot, my phone is dying, so I'm gonna have to cut out here. I'm on 3%. I've been at the conference and talking to just some really awesome people who are passionate about public school health, not even school health, but like schools in general. This conference was all about like college and schools and building bridges to success. And so it was really me highlighting the power of mentorship and how it shouldn't be something that is like a second option in your life. It should be like a forefront of your life and career, because you're only going to do things a lot faster with mentorship. It accelerated my career personally. It accelerated the people who I've helped significantly. And again, my sister as an example to how she was able to become a paramedic 12 years sooner than the average person through mentorship. So she's making a salary 12 years sooner than the average person. She's in a male predominant position, also in a white predominant position, and she's a black female. So she's breaking barriers. She's actually inspiring other women to do the work that she's doing, because outside looking in, it doesn't look like they belong there. But she's been able to do that. So super passionate about mentorship. And yeah, that's why I haven't taken a break, Miss McSnoofs, whatever your name is. But thank you for tuning in. If you guys have any questions, connect with me. But my phone's about to die. I'm so bad about that. But I will be on YouTube even more. Check out my channel, subscribe. We're trying to get about 1,000 people to be subscribed to our channel. And there's some really great content there for you to check out. I don't just talk about mentorship, though it is a big passion of mine because it's changed a lot of lives around me. But I also talk about improving health outcomes of communities by working with health organizations and leadership to work to improve health outcomes, right? We're trying to build trust with communities to ensure that they have the access to resources that they need to live a better life, a better quality of life, a longer life. And yeah, thank you for your time and thanks for tuning in.